Welcome in this clinical webinar hosted by the European Pressure Ulcer Advisory Panel. Today's webinar is joined by 455 participants from all over the world. Next slide, please. My name is Dimitri Beekman. I'm a professor of skin integrity and clinical nursing at Ghent University in Belgium and Örebro University in Sweden. I'm the current president of EPUAP. The topic of today's webinar is the coronavirus disease 2019 or COVID-19. The virus was first identified in December 2019 in Wuhan, China, and has since spread globally, resulting in an ongoing pandemic. While the majority of the COVID-19 cases result only in mild symptoms, some progress to the acute respiratory distress syndrome, known as ARDS, multi-organ failure and septic shock. One study in China found that 5% of the patients were admitted to the ICU. 2.3% needed mechanical support or ventilation, and 1.4% died. Mechanical ventilation becomes more complex with ARDS, and many patients are positioned in a prone position. Proning, or the prone positioning, is the placement of patients with their chest or face down, putting different bony prominences at risk for pressure ulcer development. Several risk factors have been suggested, or several factors have been suggested to explain why this particular position has potential to improve the survival rate. The first reason is the better oxygenation due to the physical effect of the position. It reduces the body weight on the diaphragm and the lung. A second important reason is the reduction in ventilator-associated lung injury, as the stress and the strain on the lungs is reduced. A third reason is improving the effectiveness of the right ventricle of the heart, which pumps the blood through the lungs. And a fourth important reason is the better evacuation of lung fluids, causing a reduction in the ventilator-associated pneumonia. Prone positioning is associated with an increased pressure ulcer incidence risk compared to supine positioning. Patients in a prone position need surveillance and active prevention. As we all know, the virus is primarily spread between people during close contact, often via small droplets produced by coughing, sneezing, and talking. The droplets usually fall on the ground or onto surfaces, rather than just traveling through the air over long distances. Our medical staff treating COVID-19 infected patients, they wear personal protective equipment, or PPE, including masks, goggles, face shields, and protective gowns. Research points out that approximately 40% of the clinicians experience serious skin injuries related to the use of PPE. What are the aims of this webinar? The first aim is we are aiming to share recommendations to decrease the impact of mechanical interactions between the skin and the support surface or device related to the application of PPE and prone positioning. We also aim to share implementation learnings, and of course, we aim to provide a platform for Q&A and discussion. It is a pleasure to introduce the agenda of today. The first topic on the agenda are clinical experiences and recommendations for both prevention and treatment of skin and tissue damage due to wearing personal protective equipment. The second lecture will deal with clinical experiences and recommendations for pressure ulcer prevention in prone positioning. And the third lecture of today will focus on implementation challenges and opportunities related to prone positioning and PPE skin injury prevention. And we will end our session with a Q&A. Before introducing the esteemed speakers of today, I would like to highlight that the information in this clinical webinar is for general purposes only. All information is provided in good faith without making any representation or warranty of any kind. Specifically for the PPE information, we highlight the importance of adequate fit and seal of masks to provide effective exposure reduction. We also refer to the manufacturer's instructions for specific information and guidelines. And now it is a pleasure to introduce our esteemed speakers of today. We start with Professor Paulo Alves, who is an EPUAP trustee and an assistant professor at the Catholic University of Portugal in Porto. He's also the president of the Portuguese Wound Management Association. The second speaker of today is Ms. Marit Achtiala. She is an EPUAP trustee and an authorized wound care nurse at the ICU of Turku University Hospital in Finland. And the third speaker of today is Mr. Steven Smets. He is also an EPUAP trustee and chairman of our educational committee. He's a clinical nurse specialist in wound care and chairman of the Pressure Ulcer Prevention Committee at Ghent University Hospital in Belgium. Please remember that this is an interactive webinar, so you can submit your questions during the broadcast using the chat or question function and the selection. So please remember that over 450 people today are watching. A selection of the questions will be answered by the speakers at the end of the lectures. And now it is my pleasure to introduce the first speaker of today, Dr. Paulo Alves from Portugal. Paulo, the floor is yours.
Thank you very much. Next slide. Today, I'm going to speak about the prevention of skin lesions caused by personal protective equipment. And for now on, I will use the terminology PPE to speak about them. So we'll speak about adequate facial skin care before and after the use of PPE, and the application of an interface between the PPE and the skin in the areas of pressure and friction. Next. We are going to talk about what we want to highlight. In the next slide, I'll start to speak about the facial skin care before and after work shifts, especially in this phase of the intense use of the PPE. The contact of these equipments with the face, which having a more sensitive skin in the face than in other areas of the body, requires a special attention. In conditions of the prolonged use without rest periods that allow the skin to recover, the occlusive, irritating, and traumatic effect of the various PPE can cause various injuries and even facilitate exacerbations of some more common or latent pre-existing skin diseases. Next. The better the conditions of the skin, the more resistant it will be to aggressions induced to prolonged and intensive use of this equipment. We must be aware that the loss of facial skin integrity creates a portal of entry for pathogens, such as the coronavirus specifically, but also other hospital-acquired bacterial, viral, or fungal infections. So we need to be aware that we have to differentiate our selection between the different levels of risk. And this is really important during this presentation. Next. First, we are going to adopt the approach in dermatology now on. So we'll use the protect, the cleanse, and the restore. In the protect, we want to keep the skin dry to ensure a perfect fit of the mask with the facial skin. So we can use a moisturizing cream with a simple formulation, preferably without potentially irritating additives. We also say that cosmetic procedures are not recommended and makeup should be avoided because they reduce the protection of the tissues. Consider the use of an interface between skin and PPE to protect against lesions, and this topic we'll talk later. In relation to cleanse, washing the face and the neck carefully is one of the most important parts of the skincare routine. So the skin should be washed gently with lukewarm water and dried carefully without rubbing, preferably using hypoallergenic synthetic detergents. And the last, to restore, we need to intensify skincare after using the PPE and in between the work shifts. So we can use a restorative moisturizing cream with a simple formulation, preferably without potential irritating additives. But of course, in case of ulceration or blisters, good practices in wound care are advised. So restorative formulas and or dressings may be considered. In the next slide, you will see the proper evaluation and protection of the skin. So we should inspect the skin under and around of the PPE for signs of injury, pressure, redness, or moisture. We should identify key areas like the forehead, the nose, the malar region or the cheeks, and the ears. And the specific mechanical and physical factors for each one to define different strategies, reduce friction, or redistribute pressure. If the skin presents signs of friction in the area of contact of the PPE, we could apply a skin protecting product that reduces the coefficient of friction for the skin surface. Note, do not use products with high water content because these products can impair the skin barrier. The next slide, you'll see that it's important to select the PPE compatible with the level of risk and care that you will provide. So if you want to select, we need to ensure that the PPE fits correctly so that the device provides the intended protection. As if you can look here carefully to these images, to this specific equipment, and you see the marks on the face on that specific key areas, and you need to learn with it. One thing is important. In the next slide, you'll see that we need, if we have the possibility of selecting different PPEs, in this case, different masks, with the same level of protection, but with different shapes or forms, can reduce the mechanical forces in the same areas without reducing your level of security. On purpose, I didn't use any kind of brands or from manufacturers, but because we respect the instructions of these manufacturers specifically. So our recommendation is, if you are using a specific mask, first, look to the instructions of the manufacturers. But one thing we know, we don't have the same faces, and the standard masks don't adapt to all kind of faces. So does the one size fit all? You'll see in the next slide that avoiding exaggerated forces in the fixation sites with the objective of guaranteeing optimal sealing, since it will increase the pressure and friction on these places, will result on discomfort, and there's a high probability of injury. By adjusting the PPE to the anatomy of the face, the sealing will be optimized and the mechanical forces will be more evenly distributed over the contact area between the PPE and the face. Please confirm that you do not feel discomfort or pain in specific points of contact between the skin and the device. And here there are some examples trying to remove the friction forces of the elastic of the mask that you use in the ears. On the next slide, we'll start to include, if you want to reduce the forces or the pressure, the use of dressing material or interface between skin and the PPE. At this time, we want to say that there is no skin protection product in the wound care industry which has been specifically tested for the permeability for the coronavirus, which we need to understand that some recommendations on some manufacturers, they say that applying prophylactic dressings onto sensitive facial sites may compromise the seal of the mask. So it's important to make sure that you follow the instructions. First, wash and dry the face, specifically in the places where the dressing material will be applied. Cut and adjust, and you can see here some images and some sizes of the material to the application site. And of course, the proposed materials are the majority with silicone foam dressings, thinner ones, but also films and hydrocolloids are possible to use, but there's a risk of not performing the same way. But we need to understand that there's not always the same products in each site. The next slide, you'll see that the size, the shape, and the adaptation of the PPE is important. You will see that the use of an interface, whichever one is chosen, must be continuously evaluated, monitored, and reviewed by the users in order to find the solution that best suits the professional. If you look at the example of gaskets, they are made of flexible materials which allow them less than perfect shape, mating, and touching surfaces, including these specific ones on the face, to form a tight seal. As I told previously, standard masks are made in standard sizes, and that's the difficult part. We cannot precisely conform the anatomical facial contours of each individual. Therefore, we can also, with the dressing, try to protect some gaps and pores. In the next slide, you will see a different mask, a different dressing, and the importance that we have to see that there's a correct seal. Prophylactic dressing should be used with the capacity to alleviate mechanical deformations and stresses in the tissues. Of course, they need to be flexible and elastic to act like gaskets and then contour to the facial sites, such as the bridge of the nose, and actually they can improve even the seal rather than compromise it. But again, follow the manufacturer's recommendations. On the next slide, you'll see that specifically prophylactic dressings used should have peer-reviewed evidence demonstrating that alleviation of mechanical tissue deformation and stresses exists to have a good seal. And you can see perfectly well the changes when you try to protect or not that specific skin. In the next slide, you will see that it's important to use the dressings in the correct thickness and rigidity, because if you use a slide that it's too thick, it could compromise the seal of the mask. So again, select a thinner dressing to protect that area. In the next slide, you'll see that even without the use of dressing material or interface, healthcare professionals should always check the complete seal of the mask for their own safety. In the next slide, you'll see the videos that show that the respiration or even the blunt that you can see fog on the glasses, they reduce the impact or even the seal of the mask. If it's possible to see the video, you will see the movements of
I think we are having a practical or technical problem.
I'm here again.
Oh, okay. Paulo is there. So, Paulo,
Sorry.
floor is yours.
So I was saying that I hope you have listened before. I'm saying it's even without the use of any dressing materials, you can see on these videos, that the fogging of the glasses, we can question the real sealing of the masks in all individuals, respecting the indicators of their producers. So you can see quite well that the fog on the glasses showing that probably there's not a correct seal. One of the things that we can do while using the PPEs is the pressure relief. And in the next slide, we recommend that during each shift, the health professional must respect the institutional guidelines for changing shifts and in the risk area and replacing the PPE. Of course, you can see in these images different times with the same masks in different population. We can see that different marks in different areas, but the problems are almost the same. In the next slide, you will see that at the end of the shift, we recommend that you should remove all PPE, all the PPE and the interface material that you are using, because the skin, we can have a contamination on the dressing or the interface that you are using. If the skin is dry, we can apply a water oil emulsion in a thinner layer to help the stressed skin to regenerate until the next shift. We should not use alcohol on that tissue. But the problem is, in case of lesions, blisters, or ulceration, we have an increased risk of a gateway for infection, and we need to protect that area. We recommend to select an appropriate wound dressing based on the goals and the specific needs at this particular time where occlusion is essential. We recommend changing the dressing every time you substitute the PPE and every shift due to high risk of contamination of the material and spread to other personal places. Please always confirm the integrity of the dressing because it will deteriorate over time under these severe conditions. If it doesn't maintain integrity, replace it. To finalize, we recommend the appropriate local treatment according to the existing scientific evidence in order to prevent permanent scars on the face that may have an aesthetic and self-image implications. Please use in the best way that you can this kind of information. Thank you very much. I'll pass to Merit.
Thank you very much, Paolo, for your interesting lecture. I would like to invite Marit Ahtiala from Finland for her presentation.
Thank you very much, and hello everyone. Thank you for joining the webinar. I will be speaking about the challenges we face in ICU when positioning the patient on prone. Prone positioning has shown to be associated with an increased risk for pressure ulcers in several publications. The pressure ulcer incidence in prone position treated patients can be even over 40%. Treatment on prone is very complex, often life-saving procedure, and a multidisciplinary team has to work together to secure the patient's safety in all aspects. There are several factors which increase the risk for pressure ulcer on prone. Patients are critically ill, they need to be sedated, intubated, and they are in the ventilator. They often require vasoactives to maintain the blood circulation on an adequate level. Patients have a lot of necessary medical devices, which might increase the risk. And actually, in any position, when there is pressure on the skin and the subdermal tissues, there is risk for pressure ulcer development. Here is a simplified version what happens in the tissues if the support surface or the supportive pillows do not have the reactive or anti-deformation properties. There will be a very high pressure in the cells if the pressure cannot be minimized. According to current knowledge, deformation kills the cells and the pressure ulcer starts developing in minutes. Take off the pressure in the cells, take off the pressure or minimize it as much as possible and feasible. What can we do? Everything starts with an appropriate support surface. High quality evidence-based support surface prevents pressure ulcers on high-risk patients on supine. So it should also work on prone position. The facial area is the most demanding to protect, very vulnerable and sensitive for pressure. So we need to pay extra attention to that. So let's go through some options for prone positioning. There are several techniques to turn the patient, and here is one which we are currently using in our unit and will be demonstrated it with my colleagues. First, prepare the patient, moisten the eyes, and you can also tape the eyelids if the face will be downwards. Move all the cables, lines, and catheters so they won't be under the patient. Ensure attachment of the intubation tube. So you need, this is a very simple technique, and you need 1 silk type linen, 2 regular sheets, 3 pillows, and in this case, 5 people. The team member holding the head and the intubation tube will be in charts guiding the group. At first, we move the arms towards the body, and now we cover the patient with a sheet. And roll the very secure and a tight package. Check that you are not pressing the knee. It feels very uncomfortable. When turning the patient, try to avoid stretching the skin and tissue. That is why the silk sheet is under. Then you move the patient on one side, and then slowly, step by step, carefully turn the patient on prone. And when the patient is bigger, you might need 2 more extra people to help you. There, slowly the patient turns on prone, and with teamwork it works well there. Check all the medical devices and replace the EKG cables on the back. We are using the semi-prone technique. It will allow the repositioning and the patient to move the patient more frequently. The semi-prone technique, we put pillows under the chest, and then we will support the leg. And then please, there the leg is supported and chest is supported and devices are off, they are not pressing. And then please support also the ankle, and toes will be floating. Straighten the sheets, do not leave wrinkles under the patient. In the semi-prone, the head is not turned in the full 90-degree tilt position. You can change the position from right to left, hourly or in every 2 hours, or which is preferred in your unit. Please be careful when you turn the head. Everything has to be done with the patient's safety as the primary target. When the face is sideways, there is pressure on the cheek and the chin and the ear. You can perform the micro movements and use the technique provided by the bed. In semi-prone, there might be lower and thus more optimal intra-abdominal pressure. The size and the anatomy of the patients and the materials available determine the position patient can be placed. When the patient is slim, small-sized, it is possible to place the patient directly onto the support surface, like in the picture. When the support surface has the anti-deformation properties, it will help prevent pressure ulcers. Pay attention to offload and decrease the pressure from the abdomen area with obese patients. The prone position may worsen intra-abdominal hypertension and lead to subsequent renal and hepatic dysfunction. Here you can see one example of the special designed chest and a pelvic area support. The abdomen has space to be offloaded. Also, the lungs have more space to expand. Genitals are free from pressure, and urinary catheter does not press the genitals. The head support has place for the ear and the cheek. And the composition of the support pillow is identical to the multi-layered higher specification foam mattress. While in prone, please support the ankles and take the pressure off from the toes. Bend the knees and pay attention to minimize the pressure on the knee. There are also other types of foam supports with different structures. And here in this upper picture, pay attention to the pressure on the iliac crest. In the next presentation, you will see more products. If the head is in the 90-degree tilt, there's a risk of distension and straining the plexus brachialis. Additionally, compression of the vena jugularis might affect the venous return from the brain. There could be a risk of compression of carotid artery, decreasing the arterial flow, especially if there is an arteriosclerotic plaque. To avoid compromising the blood flow and to avoid straining the plexus brachialis, the direct face-down technique would be the best. But unfortunately, this is a very high risk for pressure ulcer development. The pressure has to be evenly distributed on a pillow. And please pay attention that all the weight is not on a chin, that the pressure would be evenly distributed. In the case when you can extend the bed and move the mattress towards the foot end, you can lift the patient forward over the mattress and gently place the head on the support, which is on base of the bed frame. Ensure that the stability and safety of the head support. On the left, head is laterally rotated, not quite in 90-degree tilt. On the right, support for the face down technique. So different possibilities. Use evidence-based practices and your professional experience when nursing the patient. Assess the skin and tissue on each rotation. And take off the pressure or minimize it as much as possible and feasible. Document the prone position method and condition of the skin and the tissue, so you can follow the protocol and do the necessary changes if you need to improve the pressure ulcer prevention. And please, these are expert opinions which will give you options and ideas to develop the care. Please follow the protocols which your hospital district or your unit is using, and consult your team manager and medical doctor in charge. Thank you very much.
Thank you very much, Marit, for your excellent lecture. I would like to invite the last speaker of today, Steven Smet from Belgium.
Hello, everyone. You already got a lot of practical suggestions and recommendations during the last presentations, but of course we're in special times and special times ask for special measures. What I'm going to tell you about is we had a lot of talking about already the prone positioning. We also had talks about the facial skin and tissue damage, but how did we implement this now in practice and which challenges and opportunities did we see here? First of all, there's a big difference between both, of course. The prone positioning, it was something we know already. It's something familiar to us. We expected that more patients would be in prone positioning, so we could prepare this better than the facial skin and tissue damage, what was something unknown for us, also unfamiliar, and also in some way a bit unexpected. We didn't expect it immediately big problems with this problem. Next slide, please. Because different times ask for different strategies. Normally we can follow models, frameworks to guide us in implementation processes, but now we didn't have that much time. And first of all, didn't we always have time? Like, is there evidence available, and can we implement this in a good way into practice, or do we just work on clinical practice? Or if there are theoretical frameworks we normally follow, do we now have the time to follow them in the same way? Mostly not. So there was a need of a fast translation into the local guidelines. Next slide, please. And of course, there was also another problem. We had, in a very fast way, many new products that were introduced in our hospital or proposed, also new techniques and strategies that were proposed. And of course, we had to react on this. If we didn't act fast enough, we would see a lot of different views, different protocols in our same facility, in your hospital. So in the other way, we also couldn't wait too long. We had to translate these needs into local guidelines also because of this. Next. Now, as I said, I want to give implementation examples, challenges and opportunities, and I will first start from in our hospital. The first reports came with us from emergency care department in the beginning of March 2020. There, a doctor called us that especially because of the high respiration, high filtration masks, that they saw that they got the healthcare workers were complaining about pressure on the nose especially, and that they wanted an extra barrier to place there. Now, at that moment, we were a bit overwhelmed. We didn't expect it at that moment. We didn't have experience with this problem. So we were looking, what do we have in the hospital at this moment? We had the non-sting barrier films like Cavalon spray, for example. We had hydrocolloids in our hospital, but not the transparent versions. We had classic foam dressings, but from the light version, we only had the Biatain silicone light 5-on-5 dressing. So we discussed a bit and we set to first test maybe with the hydrocolloids and the classic foam dressings in our hospital. Next slide, please. And we got a follow-up in 4 days, and what we saw was that they were not happy with the hydrocolloids and the foam dressings, but they also saw that in our hospital we have silicone tape available, like the Mepitac, and they saw with that they had good results, or that at least the healthcare workers were happy with that. So they started working with that, and at that moment we also had already some time to look in the literature what was told about these problems. The most things we found were especially about hydration of the skin. And we read there some articles. One of the articles was also from Amit Giffen, and there they talked about, for example, petroleum jelly, to use that on the skin. But of course, petroleum jelly is really fatty. Your mask will start gliding. It's not very comfortable to have on your face, or like, yeah, that's not really a right option. Also, when do you apply it was not really concretized. So we discussed with one dermatologist already, and we said the preliminary advice to our healthcare workers, just do good skin care, hydrate your skin regularly, and that will already do a lot. At the moment then, we saw the white paper appearing from Paulo Alves at the end of the month, and at that moment we also created our protocol. Next slide, please. And in this protocol that you can see here on the left side of the slide, we experienced some challenges and opportunities. I think you all experienced, if you're working in an institution or in a hospital, that there was an overload of new procedures, guidelines, and of course, it was not easy to find the right way and a good way to communicate all these new things to your healthcare workers and colleagues. Very important to already, or tip that I can give is only communicate your protocol when all your products are already available. We already see if you communicate before and not everything is available yet, people again start experimenting, using other things, and your protocol will get lost in the big picture. How did we do it? We had a daily newsletter from the management with some elementary points, and we asked them if we could just put one point in the newsletter that if you have problems in the facial region with the skin, hydrate well, and there's a protocol with additional tips. Only with that, and then they could click further to get the whole procedure. Another tip is keep it simple. The more details in the protocol, the more difficult that people will follow it. What we also experienced was, with this specific problem, also communicate with all the involved departments. We thought we covered a lot of departments, but at a certain moment, a lot of creams were introduced in our hospital by the pharmacy department, by the purchasing department. And at moments, people start using again other products that we proposed. So we had to bring them all together, communicate very well that we knew if there's something new in the hospital, it has to come to us that we can coordinate this. Last tip also was, if there are questions, make sure that there's one person they should contact, because also, as you see, a lot of departments involved, a lot of contact persons. If that's not clear, again, you will create maybe chaos. Next thing also to think about is, no, still previous slide, please, thank you, is also, if there new information is coming, consider the urge of implementing this, and that's the example I give here of the barrier film. As you maybe already heard, there's sometimes some discussion like, should you use a barrier dressing, yes or not? In our hospital, for example, we don't see that much lesions, so people mostly only hydrate, sometimes use just silicone tape. The dressings, they don't use that much. So we decided at this moment, we don't change our procedure yet. If there would be more problems, we can still think about it. Also, we have now, again, better quality problems, and we see it because of that also now less problems. Next slide, please. And I also benchmarked with other colleagues, other hospitals, also very important. And some other tips I can give to you. Some hospitals work with silicone contact layers, and I think about Mepitel. We also work in Belgium with Spicra. That are also options that you could consider. Instead of a foam dressing, microfoam tape is sometimes used. In some institutions, they use the barrier film on the cheeks and only on the nose foam dressings. But also some hospitals want to keep it really that simple, and they say we only use a barrier dressing like the Maple slide, and we don't suggest anything else. So it's all a bit about what's the most feasible in your institution. Next slide, please. So this is a bit about implementation, about the skin barrier, facial skin and tissue damage. If I then go to the other problem that we discussed here, the prone ventilation, this was a different approach, as already said, because this we knew this was going to happen. We would see more patients in prone positioning. So we had different questions about this and a different approach. The questions we had here was especially, we will see more patients. Do we have sufficient materials? Will we have enough staffing? Because the prone positioning has also repositioning, which asks staffing. And also, if we have extra people, do they have enough knowledge? So that were completely different questions. Next slide, please. So with this, we had more an opportunity to double check our procedure with existing guidelines. Important guidelines where you can look at is from EPUAP, NPAP, and benchmarking with other hospitals, because really strong evidence in the technique to apply is not available. So it's a lot of experience, good practice that you will have to use here. But what we saw and what we heard from other colleagues, we saw that our current practice was confirmed. We certainly did it in a good way. But still, which improvements can be made? Are there maybe other techniques, materials available? Next slide, please. And as already Marit also discussed, from other hospitals, we saw also other options. A lot of discussion is often about the preventive foam dressings on pressure points. They are certainly recommended, but we can say they're not always essential. If you have a good positioning of your patient, if you use the right mattresses, the right cushions, you can avoid using protective foam dressings. Of course, if you have them, you can use that, but in our hospital, for example, we hardly use them and we don't see many problems. Another important thing, like always, is keep it simple. I saw on our Facebook discussion page a prone position kit that was created by the Aalborg University Hospital. It's very easy if you just have one package. If you have a patient that you have to put in prone, you just have to take the package and everything is ready there. But also be critical. The less available evidence, the more possible solutions you will get. And you have to be critical about that. I will give an example of that still later on. And if you then get new materials, also don't forget, if the materials are disposable, okay, but if not, can you disinfect them well, for example? If there are zippers, it's important to look at it very well, that the infection control also agrees that you use these new materials. So all things that you have to think about. Next slide. So as Marit already said, the positioning of the legs is very important. Multiple options that you have, just keep the general principles in mind, that you spread the pressure and that you avoid pressure points. So you can see you can use specific cushions in memory foam or with air cushions, or you just adapt the length of your bed. Multiple options are possible. Next slide. Also about the positioning, I got some examples from colleagues. The swimmer's position, as you can see, is mostly used. You have to put a lot of attention to the head. There are a lot of pressure points that you have to take care of. Mostly repositioning every 2 hours is done, or and anyhow also recommended. You have to be very attentive also about nerves compression, like also hyperextension of the head is something you really have to look at. But you see there are quite some possibilities. Next slide. And also about devices, as I said, or cushions, you see a lot of options. I just give this as an example again, these two, as you can see, the Helix system is with a lot of cushions, so you can adapt very well to your patient, but it's maybe quite complex, while the Repose system is just 2 cushions, which makes it maybe more dummy-proof to work with. Next slide. And to end also, you have to be critical about the materials, but also be critical about new publications. A lot is getting published now about the COVID-19 crisis and new techniques or problems that have to be solved. Here they said is a publication about facial pressure ulcers in a COVID-19 patients. But as you can see in this picture, I don't think it was about pressure ulcer. There was especially a problem about moisture and also a Ulcer infection. This had not much to do about pressure ulcer. So also be critical if you read these new publications. Next slide, please. So this was a very brief summary of some implementation examples and challenges. And I wish you all good luck and take good care of your patient, but especially also with each other.
Thank you very much, Steven, for your excellent presentation. So I would like to thank all our EPUAP speakers for sharing their experience and for their clear lectures of today. Please remember that EPUAP, in close collaboration with all our partners, are here today and well, to support you. And our latest international guidelines are really a must-have source for reliable information to provide the best possible pressure ulcer care. So please visit our website if you want to find out more about these guidelines. So for today, we received many interesting questions, and I will present a selection of these questions to our speakers. And I will start with the first presenter of today, Paulo Alves. We received a question from Chile, and the question is as follows. In Chile, they use hyperoxygenated fatty acids to prevent the skin from breaking down. Also, hydrocolloids are being used. Do you have any other suggestions?
Thank you very much, Dimitri, for the question, and also to the colleague that made the question. And it's important to understand that, as we told, we can use different products. So hyperoxylic acids, hydrocolloids, we talk about foams, we talk about barrier films, but the question is, all the evidence that we have is being done in patients, not in health professionals under these circumstances. So you are trying to adapt what level of evidence we have. We know that if you have good skin preparation or protection, you are better prepared to aggressions with the PPEs. This is the first thing. And the other thing we need to understand that we are talking about 2 different forces. That's why we speak about 2 different techniques or strategies. One thing is friction. And of course, if you put something like Steven told us about humidity on the area, you can increase a friction on that specific area. The other thing is talk about redistribute forces. So we need to understand what kind of forces are applied on that specific situations. And you see that each hospital has different approaches. So if you are using hyperoxygenated fatty acids and also hydrocolloids, you should use it before the use of the PPE. And if you use the hydrocolloid, be aware and evaluate the integrity of the tissues because of the control of the humidity. In other situations, you can also apply the barrier film, as Steven told, to put on the bridge of the nose on that specific area, because you can reduce the friction on that specific area. But one thing I want to finalize, Dimitri, to send you back to another question, safety first. So it's important to be aware of the recommendations and try to see the indications of each specific material, because at this point, to have evidence, we should go through a scientific process, and it will require experimental and laboratory research. And at this moment, we don't have that means.
Okay, thank you very much, Paolo, for your reply. I would like to move on to the second speaker, to Marit. And I have an interesting question about recommendations for microclimate management for the face. So a very specific question is, how do you secure the tubing? Do you do this central in the mouth or more in the corners? And do you place dressings underneath a catheter?
Thank you for the questions. Very interesting questions. And about the attachment of the intubation tube, we use a very simple and cost-effective technique. We use tape. So just, so I had to demonstrate, but put it over the upper lip, upper jaw. So because the lower jaw is moving, so when you change the patient to the prone position, so it's secured better. And we are not recommending that our medical doctors do not prefer to use attachment around the neck or around the head. So just secure with the very good medical tape. And when you place the intubation tube and do just check that it doesn't press the lip. So you can attach it with the technique, just non-touching technique. And we attach it in a central of the mouth when the patient is going from semi-prone to semi-prone. But normally it's on the corner when just normal supine repositioning. And if there is just clean the face, keep the face clean, and keep the moisture out, whether just cleaning. And if foam dressings are used or needed, those we are using to under the medical devices and protect the pressure points.
Okay, thank you very much, Marit, for your comprehensive reply. And then a final question, a question for Steven about implementation. Did you implement a different method to report and investigate pressure ulcers to staff derived from the use of the PPE? Steven, I think your sound.
I just see it. Pardon me. No, indeed, it's something new. So before we didn't have to report problems like this, of course. The good thing is that it was especially a temporary problem in our hospital when we had a bad batch of masks that were used. At this moment, we don't see that much problems anymore. But at the moment when the problems were there, the plan was in the first way to contact regularly the head nurses and to see if the problems are still occurring or if they were helped with the products we had. If we kept on seeing the problem, of course, then we would start reporting it more in detail, like with who do we see the problems, when. But I think also you shouldn't overshoot. I think at that moment it would give us a lot of work, and we didn't see that many problems. And I must say, since the protocol was implemented, when there was a good skin care, when they used the right products in the right way, we saw very fast that the problems were mostly under control. So at this moment, it's just to regularly check with the head nurses, also with the pharmacy department, how many products are used. And based on that, we see if we go further with really registering the problems. But at this moment, it's just more surveillance that we do by regularly contact the necessary persons.
Okay, thank you very much, Steven. Just to mention, we received in total 25 questions. So we will go over the questions after this webinar, and we will make a selection, and then we will reply to these questions, and we will provide like a document which we will post on our EPUAP website. So before leaving you today, I would like to share my appreciation and big thank you to all of you working in the front line of this pandemic. Whether you're working clinically or in a supporting role, your dedication, your passion, and your warm heart, they saved many lives, and they brought us all together in these unprecedented times. I also would like to invite you to complete our online evaluation survey. So for us, this is a new experience, and we hope that it will pave the path for many more webinars to come. So your input and feedback are very much appreciated. But for now, as the speakers already said, please take good care of yourself and of others. Thank you very much.